Hi everyone, it's Tara Bianca with Be Light Transformative Therapy, and today I want to offer you some simple manual techniques, some simple self-massage techniques for helping to mobilize and soothe the internal organs during a flare-up of IBS symptoms. The reason I wanted to bring this up today is because many of you know I have a long history of dealing with digestive issues and gut dysbiosis, and it's been really well managed for the last couple years, and I've been really able to live my life without those debilitating symptoms that I used to have years ago. But for whatever reason, the last couple weeks, I'm really dealing with a flare-up and a lot of internal inflammation, and I'm feeling super uncomfortable, super bloated. I'm not really sure why it's happening. I have some ideas of the triggers, but I haven't really been able to get it under control yet. So a lot of just abdominal discomfort. When I touch my organs, there's a lot of actual pain. And those of you who also have some amount of gut dysbiosis or IBS symptoms or other things going on, you know that from your stomach, from your gut, everything, it's a trickle out effect, right? So it dramatically impacts your mood. You tend to be more moody. You tend to lose your motivation, right? So it really affects motivation. It can affect mental concentration and focus. You really start to feel inflamed in other areas, and all the old aches and pains kind of start to flare up. And then it really has a dramatic impact as well on just your mental and emotional health overall. So it kind of sucks. I'm pretty bummed out about it. You know, I've been going along for a long time without having this kind of gut crash. And so I'm feeling a little like, ugh, about it. In any case, I wanted to do this session today because it's happening in real time. And I figured what better time to show you guys what I do for myself than in the moment of acute symptomology. Okay, so rather than getting really specific into the anatomy today, I'm just going to kind of do my thing that I would normally do if I wasn't on camera, and you guys can kind of follow along. I'll just give you some verbal cues, and we'll do the best we can, kind of like a show and tell, a show and do. So we've done this actually in the Diaphragm series, if any of you have watched this, but we're going to just start by kind of scooping underneath the ribs. So following that line of the lowest ribs, kind of carving out the rib cage. So we're thinking about the diaphragm as sort of that upper perimeter of all of those internal organs that are getting so congested. You know, that diaphragm plays a huge role in our organ motility. In any case, when we're breathing, it helps to pump the organs, massage the organs. And so if we're feeling stuck throughout all the internal organs, the diaphragm is actually not a bad place to start. So I'm thinking about just carving out the ribs. And so if this is my diaphragm, all my internal organs start right away, right? We've got this liver gallbladder on the right side. You've got the stomach on the left side. Your colon comes up pretty high. So you start to really run into these organs very quickly. You run into your small intestines, obviously. So we're thinking about just pulling these organs away from the chest cavity, giving them a little bit more space. So carving out these ribs, we're just going to do it a few times. There's no real prescription. It's to your own taste, to your own needs. You know, earlier today I was having a ton of pain throughout here, and so I had to go much more gently and with much lighter pressure. Right now I've been fasting most of the day just to give my organs a break from having to process too much, and they're starting to soften, and I can go in much deeper and with firmer pressure. So I'm just using the finger pads, and I'm just kind of scooping this tissue. And I'm just breathing in and out through my nose with my lips closed. And then we can take one side at a time and just kind of scoop the diaphragm. So remember, you can go under your ribs much more than you think you can. Don't go to a point where it's super painful for you. Go to your comfort level. You know, and I'm talking right now, so I'm having a harder time regulating my breathing. But when you're doing this on your own, as you exhale, you can think of sinking further into that space. So now I'm just carving out the left ribs, and I can even give myself a little gentle rocking. Again, it's not a precise movement. It's not a prescribed movement. I'm just feeling into my body. I'm kind of taking my knees to one side and then bringing them back to center. So sort of like a half spinal twist and then back to center. And a half spinal twist and back to center. Just adding in a little gentle movement as I carve out this left side of the ribs. Trying to pull the stomach down a little bit out from underneath the rib cage. Good. And now I'm going to keep sort of on this, we would say on the lateral border of rectus abdominis. So when you see like the six pack, right, there's a border on each side. So we're kind of staying along that lateral border of the abs and kind of sliding down it. And I'm just sliding down. And I'm sliding down almost to the level of my hip bone that sticks out here. So if you feel your ASIS here, I'm going about down to that level. So you're probably going to see me sink under the waistband of my pants. And now as I do it this time, I'm actually going to straighten out my left leg. So I'm working on the left side and I'm straightening out the left leg. And again, I'm just adding in a little rocking movement and breathing. Trying to smooth out the muscles, smooth out the organs. Make space for them, trying to eliminate any painful areas. If you hit a really painful, tender spot, you can just hold with firm finger pressure and just keep the body still and just use your breath to try to liberate this area and create more space for yourself. So always for me, that descending colon going into the sigmoid colon is always a problem. And so now I'm just kind of scooping. I'm scooping from left, from my hip bone, in towards my pubic bone, right? So in towards the belly button. So I'm scooping and rocking into my hand. I'm scooping and rocking into my hand. So this hand is just dragging from left to midline, kind of scooping into this area, right? So this is leading to that area of elimination. Good, scooping. I'm just bringing my right hips up into that hand. Again, it's not necessarily precise. This is what feels good to me, and this is what I do. So now I'm keeping that same motion of taking the skin from the side and pushing it towards the center, and I'm just rocking back into it. And I'm working my way all the way up into the waist crease now. This was really painful earlier, this descending colon. It feels like it's relaxed a little bit. And it's moved a little bit. So that's also just to tell you that you don't have to do this just one time. You can do it throughout the day as you need to try to create some relaxation in the organs. Yeah, I really feel this sigmoid colon area start to break up a little bit and relax. Good. And now we're going to do that same thing on the right side. So now I'm just getting under the ribs. So from this angle, you can see how my fingertips kind of disappear under the rib cage. And I can start to rock my knees away from this side. So rocking my knees towards the left as I drag my fingers across that rib cage. Good, and again. So I'm starting at midline and I'm dragging down towards the waist crease, just following the line of your ribs. So I'm digging in. My fingers are disappearing under those ribs. And I'm just rocking my knees the opposite direction, creating some movement. Now, normally it will feel tighter, more congested on your right side, right? Because the liver is a huge organ and it really takes up space over here. So don't be surprised if you cannot get under your ribs as much on your right side. That's perfectly normal. Okay, and just breathing. And any gentle movement that feels good to you can add in. Let's do it one more time. I also sometimes like to take my pelvis into sort of a posterior pelvic tilt and then bring it back to neutral, posterior pelvic tilt and bring it back to neutral. So just as I bring my hips into this posterior tilt, it allows me to sink deeper, right? It slackens this abdominal tissue so that I can go a little bit deeper. Really nice. And now we're going to find that lateral border of rectus abdominis. Roughly, again, we're just stroking down longitudinally on the outside of the abs. So here too, I feel a lot of congestion on that ascending colon. Taking the fingers with your breath and just gently sliding down. So gentle pressure. I'm not digging in too deeply. I'm staying pretty superficial. There, maybe you can see better here. And I'm getting to the level of about my ASIS. So remember, we've talked about this many times. That's that hip point that sticks out the front. So I'm kind of going down to that level. Just sliding down with the fingers. Now we can do the same thing, but we can straighten that right leg. So I'm going to straighten that right leg, let it relax, and I'm just sliding down. And again, you can add in this gentle rocking. I find that that rocking movement is very soothing in and of itself to the nervous system. You know, have you ever seen how maybe you are an anxious person? I know that I get anxious a lot of the time. Or if you know an anxious person, they're usually shaking their leg all day or bouncing their leg. So I feel like it's a nice way to dispel some of that energy that is pent up in our body, right? So just gently rocking the body, calming the nervous system. Good. Let's do one more like that. Okay, and now I'm going to do that same move I was doing on the other side of taking the skin from the lateral part of the body and dragging it towards midline. So I can use both hands or one hand. And now I'm going to bring my left hip up onto those fingers. So I'm taking the left portion of my body, and as my right hand scoops in, I'm just bringing my left part of my body over to meet my fingers. Good. And we're just sliding kind of transversely now, latitudinally, across the body from the hip towards the midline. And then we're going to just work our way up from the hip to the ribs. So now I'm just going to work my way up this whole line, coming from lateral to medial, lateral to medial. I'm just scooping gently with my fingers, moving that tissue around. You know, as you scoop from the side, you're unavoidably going to hit the colon. So you're giving a little bit of a colon massage here. And also kind of relaxing the abs, right? So getting into the obliques, rectus abdominis, a little bit of transversus maybe. Good. And now I'm just going back down. Great. And now I'm going to bend both knees again. And I'm just going to take my thumbs and right on the side seam of my body, I'm just going to dig in. So I'm pushing both thumbs towards my belly button, and I'm just holding them there with firm pressure. And I'm just going to take a few breaths here. Big Buddha belly. And then let it relax. Keeping firm pressure. Don't let your breath push your thumbs out. And then relax your belly. One more time, keeping firm pressure with the thumbs. And relax your belly. Good. And then one of the last things that I like to do is I'm going to just roll down the pants a little bit. I like to get right above the pubic bone. And I'm going to think about scooping this tissue up now, right? So we were pushing everything down, and now I'm going to think about taking kind of all the contents of the lower abdomen, so really scooping these small intestines and just taking them out of gravity for a while, right? Giving them a little bit of a massage in the other direction. All day they're kind of falling towards the earth, falling towards your feet with gravity. So let's just scoop them up out of that pelvic region and give the pelvic floor a little bit of a break too. So I'm just scooping. I'm using the ulnar surface of my hands like this and scooping and just slowly dragging upward. So getting right above the pubic bone. Okay, I'm digging in towards the earth a little bit, letting my hands fall towards the mat and simultaneously scooping up towards my head. And I'm doing a very, very slow drag. So I don't have any oil on my stomach. I'm just allowing the tissue to slide in its own timing. Letting it kind of melt and move how it wants to. And I'm just breathing. And so you should get a nice kind of fascial drag through. You might feel it down into the pelvic floor. Depends how hard you're pulling and the angle. You might even feel it into your adductors a little bit, your inner thighs a little bit. And I'm just keeping dragging up, 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 up. Good, let's do that maybe 2 more times. And getting right above that pubic bone again, right in the center. And scoop those ulnar borders into the abdominal wall. And then slowly, so I'm digging in and up. So my pressure is going down towards the mat, but also up towards my head, and I'm slowly dragging. This time we might even add a little range of motion, so I might take my pelvis into a little anterior pelvic tilt and posterior pelvic tilt, just tipping back and forth. If it feels good to you. If that doesn't feel good to you, leave it alone. Good, dragging slowly, allowing the tissue itself to kind of dictate the speed. So I'm not really forcing myself through too much. Good, and I think the third time, instead of taking this scooped way, let's just take the fingers, and I'm kind of right on those rectus borders again, right? So rectus abdominis borders again, so that's sort of 6-pack, right? You find the outer edges, and I'm just gonna get my fingers in there, I'm gonna relax. So now they're just coming in like this, and they're gonna drag. So I'm just gonna go towards the mat with some firm pressure. You see my fingers digging in. Actually, this spot feels pretty good in and of itself. As for me, this feels really relieving, so I'm just gonna stay here for a minute and take a couple breaths with my fingers putting downward pressure into the abdomen. And as I breathe, so if you find a tender spot and you just want to pin it, as you breathe, don't let your breath push your fingers out. Let your fingers offer some resistance to that space. And maybe you can hear the digestive noises. Okay, and now I'm just going to simply drag up slowly. So again, I'm letting the tissue kind of determine its speed. And now what I'm doing is I'm kind of hiking one hip and then the other. So I'm sort of shaking my hips back and forth and just letting that movement kind of gently assist this glide. And then let's do one more scoop of the diaphragm just to end it. Great. And then as we know, our slow breathing really helps to downregulate the nervous system, which can also really help with the digestion. So let's just take 2 minutes of our 4-6 cadenced breathing, breathing in quietly, gently, slowly through the nose for a count of 4, and then breathing quietly, slowly, gently out of the nose for a count of 6. We'll do it for 2 minutes. That just comes out to 12 breaths. So you can keep your hands on your belly. If you want to monitor the movement of the belly, you should feel your belly gently rise as you inhale and gently deflate as you exhale. I'll keep my hands a little bit separated so you can see my belly. And I'll count for us the whole time. So here we go. Breathing in and out. And 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 in. And out. And in. And out. And in. And out. And in. And out. Last time, and in. And out. And just take a moment, especially if you were having acute symptoms when you joined me for this session today, and just notice what you're feeling, if anything has changed for you, if you're feeling a softness to the organs and the abdomen now, if you're feeling less pain through the internal organs, if you're feeling mentally more calm, if this has helped to regulate your mood maybe. Maybe you've even started to create more motility in the organs. You're getting some digestive noises. Maybe it's even making you a little bit hungry. Or potentially maybe it's making you feel like you have to go to the bathroom. That's fine too. Just take a moment and notice. I hope this video was helpful for you. If you do try out some of these techniques, please let me know in the comments below how it goes for you. If you liked this video, please give it a thumbs up and please subscribe to my channel. Also, be sure to check out my totally free Breath Basics 6-day challenge. You also might be really interested in my brand new self-massage for anxiety relief video series or my breath bundle, both of which are located in my new Be Light store. And also, please consider joining my private online Be Light community for monthly live Q&As and also monthly live guided community sessions. And lastly, if you'd like to further support the channel and the work that I do here, you may always do so by visiting my Buy Me a Coffee page. Thank you so much for watching, and I'll see you next time.